Well, hello, students of Room 8, and here I am, WFH, new acronym I learned, work from home. So this is our new reality for a while. Anything I put up at Google Classroom will not be graded. It will be merely there for you to take advantage of if you like. There will be no new concepts, merely some things that I find that are interesting or a review of previous learning that you may want to engage. I thought the first one we should do here has to do with the COVID-19. This virus is causing all these problems here. And Quizizz has been doing some changes to their program to address needs of those who are distance learning. And so they've made a few changes here, but they've also put up a quiz that I thought we could go through that has to do with the virus. And so I thought, well, for our first posting, why don't we go ahead and do that? It seems appropriate. So this one's going to focus on limiting the spread of the virus. Let's see what we've got here. It is important to call the hospital to ask for advice before going in person because select all that apply. It's important to protect vulnerable patients. You may need to go to a different that one sounds good. You may need to go to a different location than expected. Yep. Limited number of doctors. Okay. They may recommend that you stay home. I'll take all of those. When you wash your hands, you should spend 20 seconds doing it. Yep. Clean under your fingernails. Okay, sounds like a good idea. Scrub the back and front of your hands. Sure. Scrub between your fingers. Use soap and water. Sounds reasonable. We have strong evidence to believe that COVID-19 will disappear in the next 30 days. I don't think so. How is COVID-19 spread? Staying inside too much? No. Touching contaminated objects? Yep. Coughing and sneezing? Definitely. Certain types of food? I don't think so. I don't know. That seems very general. Certain types of food. I don't think so. Plus it's contaminated food, but I think what they mean is like certain types of food. All right, we're okay there. How about this weather? Oh, I probably can't see that. That's because it's all white out there. Even if COVID-19 doesn't make you sick, it's important to avoid spreading it to other people. People with diabetes, okay. People with heart disease, okay. People with lung disease, elderly. Sounds good to me. Okay. Just avoid spreading it all together. It seems like a really good idea. Viruses spread from person to person. Which of the following help keep this virus from spreading? Staying several feet away from others. Good idea. Buying all of the toilet paper. No need to do that. It won't cure the virus. Elbow bumps instead of handshakes. Good idea. Wearing a mask if you're sick. Sounds good. Washing your hands. Yes. Let's do it. Race and ethnicity do not determine whether someone becomes sick or is contagious. I think that's true. Practicing social distancing means you should avoid attending large gatherings in person when possible, like going to school. Stop talking to friends and family. No. Never leave your house. No. Stay several feet away from others whenever possible. I like these two the best. Never leave your house. No. We'll take these two. Known symptoms of COVID-19 include chills. Sounds reasonable. It's a flu. Shortness of breath. Definitely. Fever. Yep. Coughing. Yep. For most people, the risk of becoming seriously ill is thought to be low. for most people. Well, I'm not sure. Most. What does most people mean? Low. I think that's false. Well, okay. I don't think that means that we should take it easy, though. It may be hard, but if you haven't washed your hands, you should avoid rubbing your eyes, picking your nose, definitely. Eesh. Biting your nails, touching your face, pretty much anything that involves your fingers to your face, probably not a good idea. Well, I guess it's good to know that most people, but I don't know if I'm a part of that most. If you can't wash your hands with soap and water, alcohol-based sanitizers are a good alternative. Well, it's definitely an alternative, and I'd say it's probably a good one. If you don't have any symptoms, you definitely are not contagious. No. You could still have it and not feel any symptoms. I think it takes 14 days for it to kick in, even if you have it. You should call to get the advice of a doctor or local health official if you live in or have recently traveled in an area deemed high risk. Okay. What's it? You should call to get the advice of a doctor. You live in or have recently traveled. Okay, maybe. I don't know if you want to bother these people, though. They're kind of like busy. You live or recently traveled in an area. I'll leave it. You have high-fived someone last month. No. You've been in contact with someone who has tested okay. If they tested positive, it might be a good idea to get some advice. You think you're exhibiting, definitely, if you think you're exhibiting the symptoms of COVID-19, you know what I'm not sure about is this. I'm going to go with it, though. Okay. For most people, the risk of becoming seriously ill is thought to be low. Thought to be low. Well, we'll go with true since I missed it last time. I'm going to assume it's high and avoid doing anything I shouldn't be doing. Okay. Oh, which two behaviors should you copy to avoid spreading COVID-19? Okay, I read this one wrong the first time. Okay. So we want to wash our hands, and if we're going to shake hands or touch somebody, yeah, minimize that. Little elbow bump there. Bad. Very bad. So there you go. So I've put this up at Google Classroom. You can share that with others and your family, your friends, and learn something about this COVID-19. And I am looking forward to a time when we get back to school as soon as possible. Take care of yourself.